This is exercise 10, dealing with joints and various body movements. Articulations, that's just the joints. That's how the bones are going to be held together. It allows for different types of movements and flexibility of the skeletal system. And when we classify the joints or those articulations, we can classify them either by structure or by function. If we look at the functional classification scheme, we look at how much movement is allowed at that joint. If it's immovable, it's known as synarthrosis. Amphiarthrosis are those joints that are slightly movable, and diarthrosis are when it's freely movable. As I said, we can also classify by the structure. Classify it by the type of tissue that's found between the bones at that joint. If the bones are connected by dense, regular connective tissue and there's no joint cavity, it's known as a fibrous joint. If there's no joint cavity, but instead the bones are connected by cartilage, then it's known as a cartilaginous type of joint. In synovials where there is a joint cavity, the bones involved with that joint are going to be covered with articular cartilage at the joint site. They're going to be separated by that joint cavity and enclosed in what's known as the articular capsule. That capsule is going to be lined with the synovial membrane, as we shall see an example shortly. And then there's synovial fluid in there to help with lubrication and prevent friction, and it is a movable joint. Types of fibrous joints are included here. Suture is immovable. Those are found only in the skull, where the examples where the cranial bones will come together. Two bones coming together is a joint, but it's immovable. Syndesmosis, where they're slightly movable. It examples with the tibia and the fibula, so you have some movement, but it's limited. And then gomphosis is another type of fibrous joint where it's immovable. This is where your teeth are embedded in the maxilla and the mandible. So hopefully under normal conditions, you don't want those to be moving anywhere. And a lot of people don't think about the teeth and how they are embedded in your jaws and the maxilla and the mandible as being a joint, but it is a joint. Cartilaginous joints, you have synchondrosis. This is immovable. It's where there's hyaline cartilage. It allows for growth, like examples at the epiphyseal plate. And then the symphysis, which is containing fibrocartilage, is slightly movable. This would be an example of your intervertebral disc between your vertebrae where you've got that cartilage. So there is some movement there. It acts as a shock absorber. Most common type of joint are your synovial joints, which do allow for free movement. Now we can subdivide those into one of 6 different types: plane, hinge, pivot, condylar, saddle, or ball and socket. With the synovial joints, you are going to have several different components of it. The articular cavity, that is the space that's between the bones involved with that joint. It is filled with synovial fluid. That synovial fluid tends to be very viscous, meaning it's kind of thick. It's a lubricant. It reduces friction. The articular cartilage, that is the hyaline cartilage that's covering the ends of the bones at that joint site. You tend to have 2 layers that will enclose the cavity. This is known as the articular capsule. The external layer is going to be fibrous, and the internal layer is the synovial membrane. Ligaments, you tend to ligaments, what we call extracapsular ligaments, that are on the outside of that articular capsule, and then there are some that are on the inside, which are your intracapsular ligaments, helping to once again attach the bone to bone. Ligaments attach bone to bone, helping to position the bones in the proper orientation at that joint site. You may have different discs known as articular disc. These are fibrocartilage pads. Another name for this are your meniscus. They tend to help cushion. You don't want bone rubbing on bone. And then bursae are little sacs filled with synovial fluid. They also tend to be located where you have a tendon. A tendon is what attaches a muscle to a bone. And so where a tendon is crossing over a bone prior to attachment, you often will have bursae there. That helps to also reduce friction because the tendon, every time the muscle contracts, the tendon's going to be moving. This is a picture showing of your knee joint. And so you can see in this area of the joint itself, there's a synovial joint. You can see that you have ligaments here that are attaching the bones. Within the joint capsule itself, you have your articular cartilage in this kind of lightish blue color here. Here is a muscle with the tendon that's coming down, and in this case it's showing it's attaching to the patella. And so underneath that tendon, between, right here is the femur, and between that tendon, this area is a bursa. It's showing the green is the outer membrane, and it's got the synovial fluid in it. You also have a bursa right here and another bursa down here in front of the tibia. You do have menisci in here, which are these pads that also are going to help cushion. You can see very easily here. Here's a lateral meniscus, the medial meniscus. This is showing the bursae removed, but you would have bursae in here. Once again, ligaments, the intercapsular and extracapsular. So these are outside the capsule, these are inside the capsule. All of these components work together to allow very controlled movement of that joint, trying to reduce friction so it can freely move without pain. With the different types of synovial joints, you have different types of movements. So we're just going to briefly kind of go over this. Gliding joints. There are some examples that are given here. Hinge joints, pivot joints, ellipsoidal joints, saddle joints, and ball and socket. Along with the joints, you have different types of movements that are allowed, and they're usually paired up. You can have a movement of, say, going in one direction, but then the movement coming back. So you have them paired up. In other words, like flexion and extension are paired up. Flexion is where you have the movement, usually in that sagittal plane, that's decreasing the angle of the joint. So you're reducing the distance between the two bones. But extension is going to be the opposite of that. So flexion would be like, say, bending the knee, but extension is straightening the knee out. So that's what I'm saying. The movements are usually paired together. One is opposite of the other. So there are the definitions here, and then there's pictures to help you visualize what these movements are. So once again, like flexion, bending the knee, extension is going to be the reverse, straightening it back out. Hyperextension is if you go beyond that midline point. Extension and flexion, we use specific terms with the foot when you are raising the toes up towards the leg, pointing your toes up. That is known as dorsiflexion. Plantar flexion is pointing the toes down. Abduction and adduction. This is going to be movements of the limbs, either the arms or the legs, and moving either towards or away from the midline of the body. Abduction, think of taking away. So you're moving away from that midline. Adduction, think of you're adding towards the midline, so you're moving towards that midline. Rotation is movement of the bone around a longitudinal axis, versus circumduction, which is a combination of several different movements. Rotation, as you can see here, would just be turning the leg versus doing a circular motion for circumduction. And this also has the abduction and adduction movements. Pronation and supination, movement of the palm. Just are you moving the palm so that it's facing upwards, or is it facing downwards? as you can see here. And then some additional movements such as inversion and eversion with the foot, retraction or protraction of the mandible, elevation and depression of the mandible, and opposition movement with the thumb. So some of these are going to be very specific, such as these right here with the foot. You only use these terms with the foot, not with the hand, and some of them will be more general. You can often use these to practice with family members, friends, etc., so that you get very familiar with the type of movements. As with anything, hopefully everything works well and healthy and under normal conditions, but that doesn't always happen. There are disorders associated with all the systems, and with joints, there can certainly be disorders associated with them. A dislocation is when the two bones that are involved in a joint are no longer in their proper orientation. You need to get them back into that proper orientation relative to each other in order to have the proper movement. And usually that's going to be painful. If you've dislocated a joint, you've got to, like I said, get it back in the proper orientation. And that there's a lot of nerves in joints, so that is going to hurt. A sprain versus a strain, from a physiological standpoint, a sprain is damage to a ligament. It's either been torn or pulled. A strain is damage to the muscle or the tendon.